Okay, so the question that we are looking at for renal failure reads as follows. If you are not able to see clearly, this will still be shared. The scenario says Mrs. Anita Monga, a 39-year-old woman, has been admitted to your ward with a provisional diagnosis of acute renal failure. Question A says, draw a well-labeled diagram of the cross-section of the kidney, which is 15%. B says, explain the process of urine formation, which is also 15%. C says, outline 5 functions of the kidney, which is 20%. And D says, discuss in details the management of Mrs. Monga throughout her hospitalization under the following headings. It says medical management, which is D1, and D2 says nursing care. So we'll start with definition in case you are asked to define, in case you are of course asked to define renal failure. So in case you are asked to define renal failure, you can say this is a renal disorder in which there is failure of the kidneys to adequately filter toxins and waste from the blood, characterized by oliguria, anuria, and drowsiness. So whenever we are defining something, we need to mention the system where this condition is coming from. And in this case, we are saying this is a renal disorder because it is coming from the renal system. And once you mention the system where it is coming from, the next thing in your definition, mention what is happening to the structure involved. If that condition has a specific cause, in your definition you also need to mention the cause. Apart from that, in your definition, at least mention 2 or 3 characteristics. So in this particular case, we are saying renal failure as a disorder affecting the renal system. It is where there is failure of the kidneys to adequately filter toxins and waste from the blood. One of the characteristics we may see is oliguria, meaning reduced urine output. Apart from that, we may also see anuria, meaning complete lack of urine production, and also drowsiness. And drowsiness occurs because there is excess accumulation of toxic waste in the blood, which causes irritation of the brain meninges, causing the patient to feel drowsy. So in cases where we are asked to define renal failure, that is how it can be defined. Now going back to our question A. Question A was saying draw a well-labeled diagram of the cross-section of the kidneys. So at least you need to have a diagram that looks like this one. Whenever you are drawing a diagram, you need to write the heading. So for example, if you are drawing, you say the diagram of the kidney. So the heading alone carries 2 marks just by drawing the heading before you even draw the actual diagram. So you need to write the heading, then at least write a diagram that can be interpreted, meaning that as you draw this diagram, someone else can be able to tell that this is a kidney. Then you're able to get the half of the remaining marks. Then when you put correct labels, then you get the remaining half. But if you draw a correct diagram, then the headings are misplaced. For example, here where it says minor calyx, so here where it says minor calyx, then maybe you label it as major calyx. Where it says renal vein, you draw it as renal pelvis or renal artery. You swap the headings, but the diagram is perfectly correct. You will not be given any marks whatsoever because it shows that you don't know what you are talking about. But there are cases where you draw a good diagram, then because of time, you fail to put the headings. You're going to get half of the marks. You only lose the marks for the headings. So when you're drawing the diagram, just remember, write the heading of the diagram you're drawing. Be able to draw a correct diagram that can be interpreted and correctly label the diagram. Then question B was saying explain the process of urine formation. So we'll go straight to explain the process of urine formation. So if you cannot copy When we talk about the process of urine formation, it occurs according to the 4 phases. And remember, the urine is filtered in the nephrons, because the nephrons are the functional unit of the kidneys. So the first step in urine formation is known as glomerular filtration. So when we talk about glomerular filtration, this is happening in the renal corpuscles. And inside the renal corpuscles, this is where we find the glomerulus, which is housed by the Bowman's capsule, if you're able to remember the structure of the nephron. So at this particular phase, the blood enters the glomerulus under high pressure, and water, ions, glucose, amino acids, and waste products are filtered through the capillaries into the Bowman's capsule. Now, during glomerular filtration, large molecules like proteins and blood are too large to pass through these capillaries, hence they remain in the blood and they go back to the body. But the filtrate that passes through the Bowman's capsule is referred to as the glomerular filtrate. From glomerular filtration, the next stage in urine formation is tubular reabsorption. Now, during tubular reabsorption, the filtrate moves through the proximal convoluted tubules, the loop of Henle, and the distal convoluted tubules all the way to the collecting duct. Now, essentially, as these particular filtrates, meaning that the water containing all the waste products, as it moves through the loop of Henle and all these structures, the essential substances are reabsorbed back into the blood. And these essential substances include water, glucose, amino acids, ions like sodium and potassium. Because they are important to the body, they are reabsorbed back. And this makes sure that the body remains or retains the necessary nutrients and fluids that it needs. From stage 2, third phase is tubular secretion. Now, during tubular secretion, additional substances are actively secreted from the blood into the renal tubules. And this may include the hydrogen ions, potassium ions, ammonium, creatinine, and drugs. So during this tubular secretion, it helps maintain the acid balance base and removes the excess substances that were not filtered in the glomerulus, so that they can be excreted in urine. And from tubular secretion, the last phase is the concentration of urine, or formation of urine in other words. So the final step is that the the filtrate will now move through the loop of Henle and the collecting ducts under the influence of the hormone, which is the antidiuretic hormone and aldosterone. So these two hormones will regulate the amount of water and sodium that should be reabsorbed back to the body. And when the body needs to conserve water or fluids, antidiuretic hormone will increase water reabsorption because it is needed back to the body. And this makes the urine to be more concentrated or to be more yellowish because a lot of water is being reabsorbed back. But when the body has too much water, less antidiuretic hormone is released, and in this case we end up producing diluted urine, or urine that looks watery or clear because the water is too much in the body. So once the urine is formed in this manner, the urine will now be pushed into the collecting duct, and the collecting duct goes all the way to the urinary bladder for temporal storage. And from the urinary bladder, now urine is passed through outside through the urethral opening. So in terms of how urine is produced by the body, it is produced by those 4 phases. There is glomerular filtration, then we have selective reabsorption, we have tubular secretion, and concentration of urine or formation of urine itself. So when we talk about urine formation, we are mostly referring or having an understanding of the nephron itself. Hence, even as you study or as you learn how to draw the kidney, also learn how to draw the nephron, because sometimes you may be asked to draw the nephron. So all those phases that we have talked about are happening in the nephron. The first stage of glomerular filtration is happening at this phase. Then we have a selective reabsorption, and we said selective reabsorption will occur somewhere, of course, at the proximal convoluted tubule. We have the distal convoluted tubule there, and of course we have the proximal convoluted tubule. So all this selective reabsorption, it means that fluids or electrolytes that had entered this loop of Henle, but they are important to the body, they go back to the peritubular capillaries, because the peritubular capillaries have to take those important electrolytes back to the body. So that is why we are saying selective reabsorption. Then when we say tubular secretion, again, when you come to the loop of to the peritubular capillaries, which are these capillaries surrounding the nephron, there are certain electrolytes which may not be in the blood at the time when glomerular filtration is taking place, but they are still in the blood and they don't go to the Bowman's capsule or the glomerulus itself, but they are still in the blood, meaning that it is during tubular secretion that these electrolytes or waste products that are no longer needed by the body, but they need to be removed by the body, they will now move from these peritubular capillaries and they will start entering the loop of Henle, because the loop of Henle is the one that is going to facilitate excretion of these waste products. And the last stage of concentration of urine, or which is urine formation itself, it means that at that particular phase urine has been formed and a required concentration is met, meaning that now urine is moved or pushed from the loop of Henle and it is pushed all the way to the collecting duct, and this collecting duct is now taking concentrated urine to the urinary bladder. So basically that is the process of urine formation. In the question that we are looking at, you just need to explain the 4 stages. You write the heading for each stage and give an explanation in a correct orderly manner. Is it a bit clear on the process of urine formation? The next question, wastes. So the first function is excretion of waste, and of course we know that the kidneys excrete waste such as urea, creatinine, ammonium, and of course uric acids, and these are produced as waste products by the body, and by excreting these waste in urine, the kidneys prevent toxic accumulation in the body itself. The function of the kidney is regulation of fluids and electrolytes. The kidneys makes sure that there is a balance of water and electrolytes such as sodium, potassium, calcium, and chloride itself. So the kidneys will regulate all these electrolytes, and this regulation ensures normal cell function and prevents imbalance like dehydration or fluid overload, because whenever there's an imbalance in these electrolytes, it's either we have edema or we go into dehydration. So the kidneys works to make sure that it maintains a balance in the body. The other function is regulation of acid-base balance. When we talk about regulation of acid-base balance, the kidneys maintain the blood's pH, which is around 7.35 to 7.45. And it maintains this normal pH of the body by excreting the hydrogen ions and reabsorbing bicarbonate. And this makes sure that the cells are not damaged and the enzymes as well as the cell activity is maintained at a normal rate. The fourth function of the kidneys is regulation of the blood pressure. Yes, our blood pressure is regulated by the kidneys and not the heart itself. So the kidneys makes sure that the blood pressure is maintained at a normal rate by the use of the hormone which is the angiotensin, the renin-angiotensin aldosterone system. This means that when the blood pressure is high or the blood volume is low, the kidneys are going to release renin, and renin will trigger vasoconstriction and sodium retention, and this ends up increasing the blood pressure. So this mechanism of the kidneys, when the kidneys are working in a normal capacity, it helps restore the blood pressure and maintain normal circulation. And that is why the kidneys have a function of blood pressure regulation. And the fifth one is hormone secretion. The kidneys also act as an endocrine organ by producing hormones, and the specific hormone that is produced is erythropoietin. Erythropoietin is the one that stimulates the bone marrow to produce the red blood cells, where in cases where we have low oxygen levels. And apart from that, erythropoietin also stimulates production of calcistrol, which is active vitamin D, and this helps regulate calcium and phosphate metabolism, which is needed for healthy bones. So when we talk about at least 5 possible functions of the kidneys, these are the functions that we can mention among others that were asked by the question. And of course, the last one is detoxification and drug excretion. So the question requested for 5, you can write any 5 out of these 6 functions are mentioned. So that is about question C, which said outline 5 functions of the kidneys. When you go to question D was saying discuss in details the management of Mrs. Monga throughout her hospitalization. And the best part is that this question, the headings are divided for you. They have told you what they want is medical management, what the other aspect is nursing care. Sometimes the question will just say describe the nursing care. It means that in this particular case, you are just writing the nursing care alone. And mind you, nursing care or nursing management means one and the same thing. The one that is different is why you are asked to say nursing care plan. That case, it is specific. All you need to write is the nursing care plan. Now, when you are writing the management, we'll start with the medical management as requested by the question. Now, because the headings are divided into 2, meaning that on each management part that you are writing, you need to put M's. And in this case, all you need to put is just 2 M's under medical management. Then when you go to nursing management as well, you are going to put 2. And in this case, you can say to identify the cause of renal failure and also to promote drug adherence. Under medical management, you are supposed to do too many things. You are supposed to look at investigations and also look at treatment itself. So whenever they say medical management, you are doing 2 things. It is investigations and medical treatment. And under investigations, at least you should be able to come up with 5 points on investigations. The first one, of course, should be a history taking point, and in this case, the patient may present with history of oliguria or hypertension, because these are 2 common risk factors for renal failure. Apart from that, during physical examination, the patient will present with a dry skin, edema, or dehydration. You can do other lab investigations like urinalysis, which will show reduced amount of urine, blood or proteins in urine as well. You can do also lab investigation, which is blood for urea, nitrogen and creatinine, which will be elevated. When this is elevated, it is an indication that the kidneys are not removing them. So hence we would suspect that there is renal failure. We can also do other diagnostic studies or other studies like renal ultrasound scan, and renal ultrasound scan will show damages to the kidneys. So all you need is at least to mention 5 investigations, and you need to mention on each investigation you state, you should mention what will show or what will come out positive or what you are trying to look at. It is not just mentioning to say I'll do urinalysis, I'll do blood for nitrogen and creatinine, I'll do renal ultrasound. So like that, without the reasons, your statements are incomplete and you will not be given any mark whatsoever. So after you do at least 5 investigations, you should mention at least the 3 possible drugs that can be given to treat the condition. Now, in this particular case, when you look at our scenario, our scenario has not mentioned the risk factor that the patient has who is suffering from renal failure, meaning that we are just going to give general medication that can help with renal failure. But there are cases where they will tell you a treatable risk factor. An example is hypertension is one of the risk factors of kidney failure. Heart failure is also another example of kidney failure. Rheumatic heart disease is another example. So those examples are medical conditions which have specific drugs that treat them. So in cases where you are given a specific condition that is treatable, on treatment you are supposed to also mention drugs that treat that particular actual cause. But when you go to our scenario that we are looking at right now, in this paper they did not mention the cause. It means that we are mentioning just general drugs that can be given in whatever type of renal failure the patient has, where you don't know yet the actual cause. And one of the drug is prednisolone, 25 milligrams once daily. On each drug that you mention on treatment, you should mention the mode of action, at least 2 side effects, and at least 1 nursing implication. And in this case, we are saying the mode of action is a corticosteroid, and the side effects that may be seen is weight gain, insomnia as well. And the nursing implication, you need to administer the drug with food to prevent gastric irritation. So for each of the 3 drugs that you're mentioning, you need to have all these details. When you mention a wrong dose but the other information is correct, you are going to be given a 0 because you have mentioned the wrong dose. But in cases where you mention the correct drug and you skip the dose, and the other information is correct, you'll be given 4 out of 5 for each drug because they will only remove 1 mark for the dose. But where you add the wrong dose, it's a 0. It means that you simply don't know. So make sure that as you mention the doses, they are correct. And it's not just mentioning drugs, but you need to mention the actual drug, the dose, the route, mode of action, and everything. The other drug that can be given, still a corticosteroid, which is hydrocortisone, can also be given. The third drug that is given, it's a diuretic drug, and in this case we can give furosemide, which is Lasix, and furosemide is given because of the edema that is seen in renal failure. And the nursing implication for furosemide, you say you need to give this drug together with slow K, and this will promote retention of electrolytes because furosemide will cause electrolytes to be lost, and you end up worsening the symptoms of the condition rather than improving them if given alone. So once you mention at least these 3 specific drugs, then it that you are ready to move on to the nursing care. So question D2 said, describe the nursing care. And in terms of the nursing care, again, you start with at least 2 M's. You are going to say to relieve symptoms of renal failure and to prevent complications of renal failure such as hypertension. This is because the renal failure can complicate in hypertension. Again, hypertension can result in a complication of also renal failure. So all you need is just to put 2 M's because the headings are separated. And in this particular condition, you are just using general nursing management, which we call or abbreviate as a prophenema. So you will need to memorize the points of this general nursing care because we'll use it in most conditions which are general in nature. And the points are the same and the headings are the same. So all you need is just to memorize the headings and the points. And in this case, you talk about the environment in the nursing care, talk about position, and as you write the points, remember the points that I've projected. I'm not adding dots like that on each point. I'm not adding any. When we say you are writing using a paragraph, it means that just write the points on each heading the way they are projected to you without dots or indentation in front because it is an essay. So you write a heading, you underline, then you give an explanation under that heading. From position, you talk about rest, and these are the points that you can talk about, and you notice that all the points that are stated are having a reason at the end, meaning that each point that you mention should have a reason for you to get the full mark for the that point. From rest, you talk about observations. Observations talk about the psychological care. Psychological care, of course, you talk about hygiene. You talk about what you do in terms of exercise, and you talk about nutrition. And on nutrition, you realize that there are certain points that are just specific to a patient who is having renal failure. So also, as you write your points, let them be specific. From nutrition, of course, you talk about medication, and finally you talk about the nursing care is of course advice on discharge. So when we talk about, or when we say on that condition you are using general nursing care, in other words you are using a prophenema, which is this outline, but you need to read through the outline, pick out or memorize the points on each heading, and at least write it correctly. But it is not in all conditions that we'll look at where we will apply this outline the way it is. It will be changed depending on the condition that we are looking at. But for all general conditions which are not emergency and which are also not infectious, it is where we apply this particular nursing outline. The last part before, of course, if you are asked to talk about the nursing care plan, one of the problems that can be seen is a problem to do with fluid volume excess. So now, how do you identify problems in a nursing care plan? A nursing care plan means that you're identifying problems based on the medical diagnosis. What it means is that since the patient has renal failure, what problems are being seen on the patient because they have renal failure? And that is what a nursing care plan means. And you can easily pick out problems of a nursing care plan from the signs and symptoms. But some symptoms you cannot just phrase them the way they appear in signs and symptoms, but you need to rephrase them to fit in a nursing care plan. And this is what I'll talk about. Again, when you are dealing with a nursing care plan, we are just concerned on these 5 headings being given from the nursing process. And these 5 headings, when you identify a correct problem, you will be given a 1 mark. When you come up with a correct diagnosis, you are given 2 marks. And the correct diagnosis, if you are dealing with an actual problem, it should be related to something with an evidence. When you come up with a correct goal or objective, you are given 1 mark rather instead of 2. So you are given 1 mark, and your objective should also have a time frame. On interventions, you're supposed to come up with at least 4 interventions with rationales or reasons for you to get the full marks. And your evaluation should have an evidence for you to get the remaining 2 marks. So this is how come you get 10 marks for each problem that you answer, and 50 marks for 5 problems if you're asked about a nursing care plan. So in renal failure, one of the problems that we can see is fluid volume excess. Now, fluid volume excess, as a nursing diagnosis, you are going to say fluid volume excess related to impaired renal excretion evidenced by edema and crackles in the lungs. So when we say the diagnosis should be related to something, you cannot write related to disease process, because that is what we are asking from you. We are asking you that from the disease process of renal failure, what exactly is causing fluid volume excess? So when you say fluid volume excess is related to disease process, we are going to mark you wrong, because you have not told us exactly what is causing the problem. It's like you're sending the same question back to the marker. So when you say related to impaired renal excretion evidenced by edema and crackles in the lungs, then your nursing diagnosis become complete. And from there, your goal is patient-centered. You can either use objectives or you can use goal depending on what you are comfortable with. So in this case, the goal, you can say the patient will have reduced fluid volume within 24 hours of nursing intervention. And in terms of intervention and rationale, of course, you can monitor fluid intake and output to help identify fluid retention early. You can weigh the patient daily to detect changes in fluid balance. You can restrict fluid intake. You can administer diuretics. What you need to make sure on intervention is that if you are mentioning an intervention to do with the drug, let that point come as a last point. And on evaluation, you can say the patient's fluid volume was reduced within 24 hours of nursing intervention, evidenced by lack of dyspnea and reduced edema. So when you are writing evaluation, you are evaluating your goal. So you are evaluating your goal, meaning that the language on evaluation and goal should be the same, because that is what you are evaluating. And your evaluation should always have an evidence as to whether your problem was sorted or not sorted. So when it comes to problems, that is what we can identify. But apart from fluid volume excess, the patient in renal failure can also have fluid volume deficit. And for you to put these two problems, you need to know the symptoms in the scenario. If the patient presents in oliguric phase, meaning that they are not passing urine, that is when they will present with fluid volume excess. But when the patient presents in polyuric phase, it means that they are in the end stage of renal failure where urine just comes out and they need catheterization. So in that case, the patient ends up having fluid volume deficit. So it is not just memorizing that these problems apply in renal failure. Also look at which phase is the patient in so that you put a correct problem. So if a patient is in polyuric phase, the problem will be fluid volume deficit, and you go to interventions, you find that the points will also be specific. So at least that is how we answer a nursing care plan. So try to go through the problems as I share these slides and see how they are phrased. But the encouragement is that you need to be trying to